people to this. It is my honor and privilege to welcome you to SnugNest. This is a foundation we started a few months ago, and the plan is huge, and we need as many of you as possible to help us make things better for old people in this country, Nigeria. So without wasting your time, because as you can see, it's 11 minutes past 12, I want to introduce our first speaker for today. It is difficult to introduce someone you know so well and who has done so much, so that you may even turn introducing him into a full speech. Okay, but I will try my best to not allow so much I know come in right now. So, ladies and gentlemen, Dr. Emmanuel Osakwe was a classmate of mine, well, classmate of many years. We've been through thick and thin together, and I am delighted to see how much he has grown. I knew when he was pushing for his career through the university in the UK and then to the US where he's doing his program. And recently, Emmanuel just returned from a tour around the world. I cited him with my Google map in the Philippines, where he was in primary care places, helping out, doing things over there, and moved around many countries, and he's back in Texas in the United States now. It is 12 minutes past 6 a.m. over there where you are now, I know. So Dr. Emmanuel Osakwe, thank you so much for accepting to do this, and I welcome you to take the stage and talk to us about finishing strong. Dr. Emmanuel.
All right. Thank you so much, Alex. Too much introduction, but we'll get right into it because I understand I have just a few minutes and then the other person will give us more. Again, my name is Emmanuel Osakwe, and then I'm a PGY2 resident in family medicine here at Texas Tech University. I just want to get right into it because what Alex, and thank you so much, Alex, for kind of identifying with me to kind of start this, to chip in with this, your startup. Expanding healthcare access is something that I hold very dearly. And then there's something to say about just staying outside of the ring and always talking about what to do. Now, it looks like the torch is in our hands. We need to start to that future that we're trying to see for healthcare in Nigeria. It's we that have to do it. So thank you, Alex, for the bold initiatives as always, and jumping into the ring and starting this. I hope that it grows and meets all of your ideas. So if you allow me, I'm going to share my screen so we can get right into it.
Please, thank you all. Let's all mute ourselves as Dr. Emmanuel continues with the lecture. So you can share your screen now, Dr. Emmanuel, and continue.
Yeah. So can everybody see my screen? I believe you can see it, Alex. So right on, let's get into finishing strong. Care of the elderly in a developing country. This time around, our focus will be Nigeria, right? That's where all of us, the terrain we're very familiar with. So there's a little aside picture just to show that every phase, we are all in different phases of life. The sweetest ones seem to be the beginning, but the ones we're most concerned about will be adult and old age, as we'll see when we progress. So for the purpose of this kind of 20 minutes talk, we'll just want to look at these few things and help us guide and shape our discussions. So we'll just do a bit of definitions and then burden of the disease, what are elderly care concepts that are out there, hospital and home health care, talk a little bit about SnugNest, what it does. Since it's very new, I'm also learning what it does. So we'll kind of have that discussion together and then talk about accessibility and affordability, home health services, and then we kind of wrap up. So holistic care for the elderly, what does it really mean? we know there are different aspects of holistic care. Remember the WHO famous definition of healthcare not being just the absence of illness and disease, but there are other things that that are important. So we talk about nutrition, for instance, very important, but in our country, Nigeria, for instance, we find out that most of the problems that we carry on into adulthood stem from even childhood malnutrition. So if you're not starting out strong, how do you want to even finish strong? So, but if you're lucky to have made it to adulthood, then you want to begin to think about that. Physical exercise is something we all know. There's this department of lifestyle medicine here that kind of emphasizes all of this. It will surprise you that things we take very, very casually, like walking. So the elderly can actually decide to walk. It's recommended that every 150 minutes of walking a week, which is like 30 minutes every day, even it's walking around the block, that can even impact the healthcare for elderly. So those things sound very, very common, but they actually have been shown to kind of affect outcomes in elderly care. Safe medication use. In the next few slides, you'll see that the burden of disease for elderly people kind of much. So you'd see people taking at least 1 or 2, 3 different kinds of medications. So people who are elderly sometimes can't even navigate that. So you want to talk about that. Psychosocial well-being, very big in this part of the world. In Nigeria, maybe not so much, because there's still denial about like mental health. People say, oh, it doesn't concern us. There's too much wahala already for you to be thinking about mental health. So not very, but it's there. I mean, and if people are not emotionally well, how can we function well? Spiritual care, we know very well. We're in Nigeria, a number of churches almost outnumber healthcare institutions. So that is an aspect of care too that the elderly can benefit from. Hospice care and end of life, not very common in our climes, but I'm sure with snugness coming into the picture, you should be able to talk with elderly people as to how they want to end their lives in dignity or towards the end of their life. So estate planning and advanced care directives, these are like when somebody goes to the hospital, the elderly patient should be able to say what they want, and it's our duty as doctors to respect it, right? So the list goes on and on. It's not the list goes on and on, but the key thing here, you see that care of the elderly is kind of multidisciplinary. It's not something that only doctors can do. It's not only something that nurses alone can do, or pharmacists alone, or even people in the non-healthcare sectors like, banking, for instance. Douglas will need a budget, like you need safe areas for these patients to walk in and all of that. So it's multidisciplinary, as we'll see. Okay. For some reason, okay. So just to go ahead, just talk about who is the elderly. WHO says over 60 years of age. Actually, United Nations, HCR says over 60 years of age. But you can see that that is very relative, right? Because in a country like ours, where life expectancy is for both sexes, male and female, is like 56, of 54.6. I was even generous. So what does elderly mean? Does it mean that we're not living, generally, we're not even living up to the elderly age, right? So if elderly age is 60, and in our country, majority live like 54 years, it means that at 40 or 50, you're already becoming an elderly person. So it's kind of relative. Nigeria's population, 236 million, less than 5%. But if you put it in the context, 11.7 million, that's over the population of some countries in Europe put together. So we still have those people who are elderly and needed to be cared for, okay? This is just a graph, might not be showing so well about the age distribution in Nigeria. You can see around 45 to 49 starts to shrink. So there is a huge number of people in Nigeria who are from 25 to 40 years. So, and that's a blessing in itself and can be a cost, but we'll get to that. What are the leading causes of death? Talking about the disease burden for the elderly, COVID, CVD. CVD would be strokes, for instance, cerebrovascular diseases, lower respiratory tract cancers, and diabetes and kidney disease. These are just in that order worldwide. But let's see we'll kind of compare with what happens in Nigeria in a short while, okay? So a little bit more on demographics. So in Abuja, for instance, you see that there are about 4.5 million people who live in that area, okay? So, and we said that less than 5% of the age group in Nigeria are over 50. What does that mean? What that means is that we have a smaller elderly people population, but the bigger, younger population that can take care of the old elderly. So we need to kind of think outside the box on how we can tap into that manpower to be able to support the elderly. Just to contrast it with like the Philippines, which Alex just said, I visited last week, about 120 million, the same kind of demographics. Most people are, in the, poverty bracket, 60% within 15 to 24. So they have a high number of youths as well, like Nigeria. But why is it that our life expectancy is at 54 and theirs is at 71? There might be something we'll learn from that. And then in USA here, you see that over 340 million, they have a crisis because most people are over 45 years. Okay. Trying to go to the next slide. Okay. So in Nigeria, the top 10 causes of death, we talked about TB. So you see that when it comes to Nigeria, it kind of shifts a little bit because diseases that are communicable now come to the fore. Ischemic heart disease and stroke, but you still see diabetes and things like kidney diseases coming up, then HIV and AIDS. So the good news is that for the communicable ones, you can do something about that. So little interventions like health education, for instance, immunization, for instance, it can change the whole dynamics. You don't need a whole lot of care for the elderly. Preventive services, which home health can do, will solve the problem at that point. The few ones that get escaped are the ones that go to the hospital. So this is the TB, ischemic heart disease, stroke, cirrhosis of liver, diabetes. Those are the top ones in Nigeria. I know that I think this data was from the last couple years. So if you put the problem currently we're facing, like the whole kidnapping, road traffic accident, and all of that, then you see that there's even more work to be done. So what are the care models that exist for elderly people? There are several of them, but broadly it can be hospital and non-hospital. So once somebody is not in the hospital, every other thing they do outside the hospital can fall into like the non-hospital care. So the ACE, which is the acute care for the elderly, is the major one that happens in the hospital. And that's the kind of one we see in Nigeria, because if anybody's sick, what they do is to go to the hospital or go to the private setups. People wait until they get sick. That's our own experience while I was there. There is no incentive for like preventing the sickness. So because it's mainly people taking care of themselves, they wait when they get sick, they go to the hospital. But we can see as we go on, you see that there is more that can be done even in the home and non-hospital settings. Bridge model is when they are discharging them from the hospital before they get home. What are the things you do to make sure they don't return? Collaborative care is a kind of model that talks about mental health. Then home-based primary care would be what Snugness is trying to achieve, where they can go to the home of patients and then see patients. But also they can also do like a domiciliary home where they can have a building where like a 5 to 8 bed capacity in a building, and elderly people can come there and stay for a period of time. Transitional care, we've talked about that. That's coordinating care between different disciplines. So these care models exist, but basically they're either in the hospital or out of the hospital, okay? Okay, I want to admit someone. Okay, so what is home health? So a type of primary based health in the 19th century was popularized. So yeah, welcome, Dr. Kao. So Doctors, nurses, allied health professionals can all find a place in home care setting. Who really pays for home care? Because at the end of the day, we want to talk about cost, because that's the meat of the matter. Some people say they don't want to go to hospital because they incur cost. Others say they're not well, they don't have enough to go. But you can see here largely is the insurances that pay. In our country, I know we have the NHIS, but the penetration level of NHIS, both of us, we can all argue, like, how much percent of people who are covered by NHIS. So it leaves the burden of the rest of the burden of paying for your healthcare to individuals. So, and that can make a whole lot of difference. As at today, well, as at 2019, there was no national policy, no functional policy on healthcare for elderly. So you can see that most of the things that private people do usually look at the public sector, which is the national government, to give you a kind of direction. But in Nigeria, we don't have that yet. So I think what that might mean is that individuals or private sector can come in, and there's a lot you can do. But if we have a national regulatory framework, that will be also better. So uniquely different in the sense that we have a larger population with fewer elderly. So what can we do with this unique population that we have? Because if with a situation where we had more elderly people, like here in the United States or even in China, where like over 500 million people now are elderly, and there's not a lot of younger ones to care for them. So that presents a unique problem. But for us, it looks like we have the manpower. It looks like we have the youth population. How do we harness that? Okay. I don't know why this, okay. So I just put this slide here to see what they're doing in the Philippines. So for there, because they have a younger population, what they do is to try to, harness the manpower and harness the resources of that younger population so they can take care of the elderly. What they do is they go to a family setting, for instance. It's like Nigeria, most of our elderly people will take care of them at home, right? They don't necessarily go to the hospital, or they don't go to the elderly people's home. So what they do, they just go get a designated family caregiver, get all the demographics. What's the age, what's the civil status, what's his gender education, what's his income, so you can know what he knows baseline. And then you check the elderly patient to get all this information. So the goal is to actually train and empower that caregiver with the skills necessary to take care of the elderly. And that have given them a whole lot of results. Okay. So back to us, I said earlier that the coverage of NHI is questionable, less than 13%. Preventive services are almost non-existent. Ideally, and what about affordability? How affordable is healthcare? So you see a whole lot of things that play into the situation back home, like poverty, ignorance, and disease. So individuals are now resorting to taking care of themselves. So but we see that even though individuals are doing the bulk of them, so there's why there's the government in place. So government subsidies and reduction of health costs can go a long way in kind of helping people access the healthcare they need, especially when they are elderly. Okay. I'm going to jump this. There's a little video that was what they were doing in Kenya as regards elderly care that is here, but wouldn't have time for that. Maybe we can play, when Alex gives you guys the slides, you can just play it and see just a little bit of what they're doing in Kenya to kind of, care for their own elderly, what the home visits kind of look like over there. Okay. Like it or not, prevention is better than cure. So most times our elderly people get very sick and they fly them abroad. So this is official figures that we're getting from the national government. As at last year, 1.2 to 1.6 billion dollars was spent from people going outside the country to seek healthcare. Can you imagine and contrast it with how much the NHIS has as budget for 2023? Totally 297 million. So it kind of tells you that there's a disconnect somewhere. But again, a unique opportunity for private sector people to come in. So what are the home health care benefits? What can you do when we talk of home health care? So vital signs check, like you can check people's blood pressure. As a matter of fact, there are 12 calendar months. If elderly people, you can educate them to do one time every month, it can save a lot because we've seen that CVD, like stroke, people walk around. People are usually like, or non-formal sector like farming, traders and all of that. So they may be carrying around BP issues they don't even know. So you can do vital checks when people go to their home and check those kind of little things. They can triage them to those who need acute care and those who can be taken care of at home. Health education, we talked about, that has changed the game in places like Philippines and even right here. Immunizations, you can do some of them at home. People don't need to come to the hospital for that. Screenings and medication management is a big one because when people get elderly, the way their bodies handle medication is different from younger ones, right? So you don't want to keep giving people medication and harming them in that regard. So some elderly people who don't have anybody to stay with them, you can have nurses visit like 2 or 3 times a week and then help them in administering medication. Again, it's multidisciplinary, okay? So just a few thoughts to leave with us. We're in a space where we have fewer elderly people and more of the younger ones. It's a very unique opportunity that we have, but we're in a peculiar situation where the elderly are not still getting the kind of care that they should get. We, the younger ones, have to care for those who at one time cared for us the most, okay? So by way of recapping, so we said care of the elderly has a direct relationship with finishing strong. It's over 18 studies that's been done in different care models showed that out of hospital care kind of reduced the healthcare costs, reduced mortality and morbidity, and improved the healthcare outcomes of our elderly population. So there's a direct relationship there. Our situation in Nigeria offers a unique opportunity. We've talked about that, up to the private sector, like what SnugNest is doing. And let's continue to make that difference, okay? All right, time for questions. And these are my references. That will be it. I hope I didn't overspend the time. I was kind of looking up.
Right on point. Wow, what can I say? Thank you so much, Dr. We call him Osankwa, Dr. Osakwe Emmanuel. Thank you for this well-detailed, well-researched, well-organized, comparative presentation, looking at us, comparing us with those who have done better, comparing us with those who have our kind of demography, the Philippines. I'm glad you went to the Philippines when you did, just before this presentation. Thank you so much. Yes, finishing strong. We all must finish. We will finish, and everyone wants to finish strong. Like the tradition that's been handed over to us from our fathers, we do things the way we have learned. So if we learn to, like we have heard now, if we learn to help our older ones finish strong, our younger ones come in, will learn to help us finish strong. So everything is done by what our fathers handed over to us and what we hand over to our children. Everybody would like to finish strong. Thank you very much, Dr. Osakwe Emmanuel. You mentioned in your lecture about the lack of policy for healthcare for the elderly in Nigeria, for example. Just yesterday, I was discussing with an elderly friend and father. Yeah, because as he's aging, his children, most of his children are not in the country, some are, and they are trying to get him a health insurance package with one of the HMOs. A package was sent to me to review and see if he will benefit from it. Of course, they will have different types of packages. The small one, the medium one, the large one that can cover more, but not most, So this is somebody who has lived all his life in Nigeria. He looked at this whole plan and he has this distrust for insurance companies in Nigeria because he has been disappointed so many times. And he says, you know what, I don't need any insurance because they are all disappointing. Somebody who has lived almost 70 years of his life in Nigeria and has been disappointed almost every time, what preaching can you give him about these things? So this is where we come in Snugnest. People who have seen the disappointment, people who have even worked in such organizations that have disappointed, people who work in some other organizations now that are trying, and bringing all those experiences to bear to say, maybe we are a people you can trust to make a difference, following all what has been reeled out by Dr. Emmanuel, so that some of these figures you presented to us in the years coming, maybe little drops of water, they say, maybe we can start changing those figures as time goes on. Please, the next 4 minutes, I will take comments, questions. If I see your hand up, I will unmute you and allow you to speak. Questions, comments before we quickly hear our last speaker for the day. Anybody here?
Yes, I have a question. Can you hear me?
Loud and clear.
Okay. Does it not depend on what the economy is saying? Because in the US, for instance, there's a lot to live for me. But here in Africa, where the economy is the way it is, isn't it possible that some aged people just want to let their children be and not have to bother them with their ailing health? So I imagine that the man who says he doesn't want to take any insurance will say, whatever God says happens, happens. And so when it's my time to go, don't try to prolong my life and all that. So what are we going to say about the cultural values, the economy, etc.? Thank you.
Thank you very much, Mr. Jude. Dr. Emmanuel, please, can you respond to that quickly while we wait for others to
Sure, quickly. So I was thought about like the model of people ask more questions, I will take it, but we can take it one at a time. Jude, very good question. I talked about cultural norms and perspectives impacting even what life expectancy looks like. And then like costs and economy, I talked about these things are not separable. The system that we are in and its influence on people. For instance, I give you a personal instance. Alex here knew we were kind of contracting him to go home and see my dad. My dad, bless his soul, from the time he was diagnosed with cancer till when he passed away, it's a good 5 years. So at some point, he would say, oh, don't worry about it. For those who are not able, you're spending money. But we're like, that's the healthcare that you need. And we're happy to do that because you took care of us. So bottom line is that that's where some kind of education needs to come in, especially for those who can afford it. You tell your parents that you took care of us when you're younger, so this is our time to take care of you. But again, people who have given so much of the system, like just picking back to what Alex said, and it feels like there's a lot of distrust, and there is for sure. We cannot hide away from that fact. There is for sure, stemming from the fact, for instance, there's not even a national health policy for care of the elderly. And after so much heartbreaks and disappointments, why do you want to, even care? So you just say, oh, maybe that's what God wants. But I tell you, the ones we can control, we have to make efforts to control. We have to educate. We have to also incentivize those who are talking about this primary care, home health care services. I want to see a situation where we can come to a point where we can make our services in home health care covered by health insurance. That way we can tell these people comfortably that they don't need to pay for Snugnest healthcare services or any other healthcare services as well. And Imogo, at the end of the day, it's more like a word to word, a mouth to mouth kind of people. When people say that people are actually getting these services and not having to pay for it, then the word will quickly spread out very quickly. So I don't think when people see that it's actually working and the narrative is changing, many people will try that alternative that's given to them. That they might not be hesitation. So culture had to change, but it can be changed over time.
Thank you. Thank you so much, Dr. Emmanuel. Yeah, in this part of the world, I could remember, by the way, my father is elderly, very, very much so.
I remember.
So glory to God, he's strong. Yeah, he had asthma for a long time. Now he's more of chronic obstructive airway disease. At his age, you won't call it asthma. So, but he uses this inhaler, which in the last 1 year has quadrupled in price. So we used to get him this inhaler maybe at 5,000, 6,000. So at December, when I got it for him, it was around 33,000. And you know, the supermarket price tag, I had forgotten to remove the price tag, and by the next time I visited, I saw the inhaler. I said, it looks like you've not used this inhaler. He said, I needed to be sure if what is written on it is a code for something or the price. I said, oh, if that is the price now. So it really worries them when they see, especially looking at the society the way it is, and they see you are spending so much. They feel like they're a burden to you, and nobody wants to be a burden like that. But if it is presented in a way that it don't look like a burden, then they are happy that, okay, I'm not really disturbing this much, even though I'm being cared for. So, and that is where we want to come in to make it it's not going to be free for the children or for those who are caring completely, but to make it a way that you can breathe in very well, you can exhale and be like, wow, I don't have to kill myself to do this. And even a situation whereby you really want to care, but you don't have the skills to do a certain things. You do not know that probably your elderly loved one who is not able to walk needs to use an airbed or a waterbed, or needs to be turned every 2 hours or what have you. You do not know this, or even if you know, you cannot do the turning alone. This is where we come in. We come in with all the expertise, with regulation as well, because some of you may have nurses you bring into the house. Somebody needs to regulate what they're doing. Somebody needs to make sure they are working according to international best practices. So this is where an organization like us would come in. And I want to thank you so much for that concern you brought up, Jude, and Dr. Osakwe, for your response to that. We have questions that had come in before the webinar started. People had mailed in their questions. People responded with questions when they were registering. And then we want to quickly go to our second speaker to finish up so that we now settle down and look at a few of those concerns. Thank you very much, Dr. Emmanuel. Our second speaker, Dr. Kadia, you can start sharing your screen. Dr. Kadia is a colleague here in Abuja, somebody I respect so much, and I call her my Chief K. Dr. Kadia is so down to earth, and this is somebody you can gather all your sick people in the whole world. You want them to be seen by Dr. Kadia because of the gentle touch, the caring words, and the professionalism she brings to her job. And when this webinar came forth, I just called her straight. I said, please, can you come and talk to us about, the care of our elderly loved ones? And I'm going to be introducing her right now, Dr. Bolasom. That's your name. Makes me bite my tongue. Bolasom Kadia, please, you have the microphone.
Okay, good afternoon all. Well, those words were humbling coming from Chief Alex himself. Can you hear me? Yeah, okay. Dr. Osakwe has done great justice to the topic that I feel like, okay, do I really need to talk about it? But yes, I will still talk about what I need to talk about because I'm talking about the health management of the sick ones. So since I'm going to do that, the elderly, I want to start by borrowing words from Dalai Lama. He's a Buddhist. I'm not one, but at least I believe in his saying. Because it says...
Kadia, can you share your screen with us?
Let me see if I'll be able to do that.
Okay. You are co-host, so you can do that. Just click on the share.
Papa, you've not lost me. Hello?
Yes, so yeah.
Not seeing what is showing there.
Is your slide showing on your screen? If your slide is showing on your screen, then it will show here if you share.
Check your WhatsApp. Because I may share it from your site. I think I'm having difficulty. Yeah.
Okay then. Okay.
All right. Okay. I still can't see it.
Yeah, it's coming up now. Just a minute.
Okay. Yeah.
All right. Can everybody see it?
Yeah.
Okay, so we go now.
Yes, we can.
We can.
Okay, so like I said, I'm not a Buddhist, but I want to just borrow the words of a Buddhist, Dalai Lama, who said, what surprises him most is that most people, because of the search for money and all, they spend their whole time at the expense of their health to look for money. And by the time you've gained all the money and all, the next thing is that you're now trying to see how you can now use your money to get back your health in the elderly, which is why we're going to talk about. Dr. Osakwe has done justice defining who an elderly person is. As we know, most of our elderly ones are retired, living on stipends. And he actually mentioned that most of them, like we don't have an NHIS that is working for us. So most of them are just dependent on their kids, their children, and all that they're looking for. So as you plan to enjoy your old age, including receiving from, because most of us see our children as investments. We all go there, we plan to invest in our children so that they can take care of us. But we need to take care of our post-retirement. That is by having regular checkups. Because when health is lost, all is lost. No matter how much money you have, if you don't have good health, you won't be happy to enjoy that money that you have. So he has mentioned most of the common health challenges of the elderly, but I will still do well by just still trying to take us back. Like we know, diabetes is one of the killer diseases, and then we have hypertension, obesity, we have chronic pains from osteoarthritis. You are there, you want to enjoy yourself, and then pains and aches are there. Then, okay, complications from hypertension, diabetes, we now have people coming down with kidney diseases. I'll try not to talk much about medical jargons because I know there are people that are not medically oriented that are listening to us. They want to know why we're talking about this. We know snugness is just about taking care of the elderly. They want to take care of the elderly. So while you're doing that, as you get older, mental illness come in, like dementia. People forget things. Like Dr. Alex did justice, he said, there are two times you are children. The time when you're small, and then when you get elderly, you start trying to forget things. And then the stubbornness of the elderly actually comes in because the elderly one now feels that, I can handle everything and everything. But diabetes is the number one killer because in as much as people are scared of cancer, they're scared of HIV/AIDS, but diabetes becomes one of the killer diseases because most of our elderly, what happens? Some of them become diabetic when they are around the age of 30, 40. It's not easy for you to be dependent on drugs all through your lifetime. So they get tired of being dependent on medication. People come about with different myths. Some people will try telling you, okay, try this form of local herbs that we have. This one will come and tell you, okay, there's this new one that we have. Unfortunately, I have to make reference to this. My husband is a diabetic. And almost every month, he'll come back with one new herbs that somebody has informed him that, wow, this thing has brought down the sugar level. This person's sugar level was like 22 and it's now less than 10. I'll be like, be careful. Those things are not good for your liver, neither are they good for your kidneys. So you have to be careful about it. And then what are the complications, when diabetes sets in? Diabetic foot is one of the worst things that can happen to our elderly. But what happens to them? You have a small wound that is being ignored. This is where snugness comes in, because they have a group of people, caregivers that are well trained. They can come right into your homes to check care of your elderly ones. So they do the routine checks that need to be done. Because once you're elderly, especially if you're diabetic, one thing you need to know is that you need to be taking good care of your feet. Every day, if you're not the one that will check it, you can have somebody that is around you to take care of you. But that's one thing we're running out of in Nigeria. We have so many elderly ones that are out there, and at the end of the day, nobody is there to stay with them, to take care of them. So those are the things we have. Everybody is hustling, trying to see how they can make money. Money, we're all money oriented. Like most people will see, time is money. Yes, we keep looking for money at the detriment of our health. The time you need to rest, because everybody says you need like 7 to 9 hours of sleep, but nobody wants to sleep. So you're looking for money. And by the time you're having a small headache, you take paracetamol and then you keep going. And then you keep hearing about, okay, people that want to try new things. But what we advise, once you're elderly, once you're diabetic, you should maintain a routine check. Most times, if you're diabetic and you're under control, most times your doctor will give you either 2 or 3 monthly checkups that you need to just follow up on. Then you keep your record of your blood sugar, because there are so many things that are coming up abroad now. There are some sort of blood tests that you don't even need to prick yourself, because that's what the elderly hate about diabetes. Every day, the needle pricks comes in and all that. Then we have to it's not easy. Like I used to tell people, stay off this diet and the rest, but at least they should try to maintain to that diet that you're taking. Like what I used to tell my people, once you're above 40, I'm as guilty as charged. Once you're above 40, you need to actually watch what you eat. Because even if you're not diabetic, you're prone to it. Obesity tends to lead to one thing or the other. Then your daily care of the foot. Like I said, you need to check your feet, be sure that there's no little blister on it. If there's a blister, then it needs to be taken care of and all that. So those are the things you need to do. Then it will be good if you're a diabetic to join a diabetic group, because those are the things that will help you. They will help you to encourage everything. Then for hypertension, I know some people will ask you, doctor, why am I hypertensive? Is it because it runs in my family? I say, yes, there's some hypertension. There's some. It's because of our way of life. People don't exercise, we take salt, then some run in the family. Just imagine if you need to increase the force of water when you're watering your plants. You need to block a pipe so that at least you can raise the force so that it gets to where you want it. That is what happens to your heart. It pumps against resistance and thereby makes your heart to beat very, very fast, and then you're endangering your heart. So hypertension, just like type 2 diabetes, I said, runs in families. Like some people will say, okay, we don't have that in my family. I said, sometimes it can skip a family. It can skip a family and then it comes out in the next generation. So you need to watch what you eat. According to CDC, uncontrolled diabetes and hypertension are the leading cause of kidney failure. Yes, there are some people that never got to know that they had diabetes. There was one, the first time we checked, the sugar was like 28. The way the thing sound, and that patient didn't want to be on medications. From chronic kidney disease to kidney failure, and unfortunately, the death of the patient didn't take up to 2 years. I keep wondering, is that how bad diabetes and hypertension can be? But yes, it is. Another thing, if you are hypertensive, you will want to just wish you never had a stroke. Because if you have a stroke, I bet you, even your family, become a burden to them. Like when we talk about the elderly, if you're elderly and you're strong, like when Dr. Emmanuel was talking about the elderly out there, you see them walking around in the morning, taking their walks, they're strong. They are going about their normal businesses. But once you have a stroke, you are totally dependent on people. And what betide you if you don't recover from the stroke? You become dependent and everything has to be done by every other person. So you have to keep checks of your blood pressure, and you record it daily, because there's actually a blood pressure logbook that you can just record it, so that you will be part of the monitoring. Like from this thing said, I'm an ONG. So once I have a patient, I will just be like, you're part of my management. While you're at home, I want you to keep records of your blood sugar level. I want you to keep records of your blood pressure, so that whatever it is, whenever you come, we'll look at it. And even once you're part of the management, you're happy about what you are doing. The one I used to tell people, I say, if you're not an alcoholic, then that's a very good one for you. Because if you have a patient that is an alcoholic and you want to tell the patient that, okay, because you're hypertensive, you should stop alcohol, that is when you start seeing all the wahala coming in. They will come and say, okay, doctor, do you mean I should not take any alcohol? We advise that you take little or no alcohol, preferably no alcohol, but if you want, you can just take little alcohol. Then just like the diabetics, do your routine clinic checks and then take your medication. Like what I say, once you take your medication regularly, most times I use a bad door to explain to most patients. I say, okay, if we have a spring door that is bad and you're using like a wedge to keep it open, by the time you remove that wedge, the door just bounces back on you. So those are the things that you need to do. So once you are keeping the blood level ready, you're keeping checks on that, you keep seeing that, okay, everything is going as it should. Whatever you do, like I said, do not have a stroke, because if you avoid stroke, you have avoided everything. So you have to watch your blood sugar level, watch your blood pressure, and then you need to do your blood tests. SNOGNESS does it. They have people that go around you. They come to check your blood sugar level. They can check all the tests that you need to be done and all those things. If you can, avoid all those drugs that make you high. That's the psychoactive substances. Like I said, as you age, so do all your organs. Your kidneys, your heart, your liver. Those are things that have been working right from when you were inside your mother's womb. So you need to really, really, really take care of them. Because if you don't do, you will come down with so many kidney diseases and all. When we talk about the aches and pains of, because once people say, once you get to 40, it's a life of aches and pains. But I tell people it's not always so. But yes, arthritis sets in. So it gets in, you just want to relax, but the aches comes in, so you're taking either one pain reliever or the other. Then somehow with aging, especially for those of us that are on the tall side, spondylosis comes. Okay, can you hear me?
Yeah,
hello?
I can hear you, but you break every now and then. Yeah, very clear now.
Okay. Okay. So spondylosis comes in, then pains, like for those that have peptic ulcer disease, cancer, all the pains come in. So the chronic pains of the elderly is one of the things that the elderly comes with. So the important thing here is do not self-medicate, because most people, once this person has been on a pain reliever, the neighbor will be like, okay, I have this pain reliever that was prescribed to me. Can you take it? Some are muscle relaxants. You don't know why that pain reliever was actually prescribed to the person. So please do not self-medicate if you have an elderly person. That's why you need the likes of SNOGNESS to come in, check on your elderly. Like I have people in my place, like I used to tell people, when it comes to tradition, they have an aversion for old people's home. I have a lot of people that will tell you that, okay, they don't want anybody of theirs to go to an old people's home. But what I tell them is that with old age comes a lot of things: isolation, psychosis, dementia, and then even depression. So when these people are together with their people, they enjoy staying together in the old people's home. It's just like children. I used to say, when we were growing up, we had an aversion for going to school. But when you look at kids nowadays, because of the way the schools are well equipped, children look forward to going to school every now and then. So that's what happens in all these old people's home. You have well-trained caregivers that are ready to take care of those people while they are there. So once they're there, they have their peers, they make new friends, they stay there and they sit down and enjoy the company of their age mates. It's just like when you are together with your own age mates, you are so happy to be around with friends. Like I say, once you're a happy person, hardly you don't, the age doesn't show on you. That most people like say, okay, age is just a number. You'll see a 60-year-old looking like a 40-year-old. I've seen so many people celebrating birthdays these days. I'll be like, wow, are you sure this person is 70? Because the person is happy. So by the time they stay with their people, they will know. Then stubbornness of the elderly. Like we said, Dr. Alex said he has an aged dad. Dr. Sakwe clearly mentioned the same thing. And then you are now the child that was raised by the parent, and you're the one now telling them, don't do this, do that, do this. So they'll just want to tell you that, okay, they don't want to listen to you. Like we've heard of a doctor that had his dad that was hiding even soft drinks. The sugar wasn't controlled. Every time, every day, they are giving the medication, but the sugar was never controlled because this particular dad was hiding his crate of minerals and drinking it. Though I never got to meet my late mother-in-law, like they will say, she always had this sweets that she must keep by the side. Every time she says it's for her grandchildren, but somehow she'll end up being the one to consume the sweets. So that's part of the stubbornness. The exercise, like we said, it's actually good, especially like if you live in places like Abuja. Yes, even if it's in a village and you have an elderly one, can just advise them 30 minutes walk around the neighborhood. They must not do anything strong. It's part of the exercise that they need. And then, like I said, the necessity for sleep can never be overemphasized. You need at least 7 to 9 hours of sleep. But when I say that, I will be like, doctors, do we actually sleep 7 to 9 hours? When you're on call for 48 hours, you're expected to be at work the next day. But yes, those are the things we need so that we will not just come back later and be using the little money we have acquired to take care of our health. So what are the factors that affect sleep in the elderly? Because they have these aches, up and down chronic aches. Then some medications that we take, like some people, you see them taking caffeine as around just 7 p.m. you're taking your coffee and you still want to take a good sleep. Definitely these things would change your sleep pattern. Then you're depressed, or you watch movies late into the night. So you keep having some little issues up and there. Home accidents, especially with the elderly, because some of them, they have issues with their sight as they're diabetic or as they're getting older, they're not seeing well. So they keep having some little home accident that add up to those things. So what are the things we do? Like I said, it will be good for them to avoid too much television in the night, especially all these news channels that you watch. Like I used to tell people, whenever I watch CNN, Al Jazeera, I'll be like, wow, the world is coming to an end. So for the elderly, those are things that you try to tell them, okay, if you want to watch all those things, watch them in the daytime so that before nighttime, you can do that. You can sleep well at night and not be thinking about what is happening in Ukraine, what is happening all over the world. Then if you have a good bedtime routine, I have an aunt, once it's 7 o'clock, she'll tell you good night because she wants to sleep. So if you can just relax before you sleep, meditate. If you're the type that loves reading, read your book. It helps you. So at least you should have the right colors. Like I used to tell people, there are some people that love very bright colors. If that is what works for you, why not? Put in your bright colors in your room, make it as cozy. Like I used to tell people, the best part of the house for everybody should be their bedroom. Because as long as it is, if it's the living room, you must not stay there. But your own room should be where you have peace. At least if you love white bed sheets, let it be that. You go and sleep well. By the time you relax well, whatever happens the next day is just what happens. Take one day at a time. One day at a time. If you are the type that loves going to the gym, like I told people, I told me I was getting fat. I went to the gym. The gym instructor was like, yeah, you can do it. You can do it. They said, please don't let them bend you too much. Because I was just like, I came here to lose weight. I didn't come here to kill myself. They'll be busy trying to make you do what some people can't do. But it's good you just be as flexible as you can and exercise as much as you can. Like I said, at least like 30 minutes in a day. I want to conclude by saying you can live your best life. You can feel younger for longer. Like I said, you can be 40 and still be feeling 30. You can be 60 and still live like you're 20. It all depends on you. You just need to be intentional about your health. Stay completely on the positive side of life and you will end strong. Thank you for listening. Thank you.
Dr. Kadia, thank you. Thank you so much for this beautiful presentation. This presentation makes us feel guilty, all of us, because even though we may not be classified as elderly, we saw a lot of things that will make us ask ourselves questions. And thank you so much. This is beautiful. So I knew we were going to do wonderful justice to this topic. And thank you for delivering at this time.
Thank you.
Thank you, we'll have a few minutes of interactions, questions. And those who were here for the first lecture, all of you are still here. Beautiful. I like the attendance of this webinar. Wow, thank you so much. And if you have comments, finishing strong, complete care of our elderly loved ones, you have comments, you have questions, please, you can unmute yourself and speak, or you can put up your hand and I will allow you to speak. As we wait for that, I'm going to read out some questions that came in from people who have registered, who are here, who sent in their questions earlier.
Okay.
So that our guests better for 10 years and you are drained. That means your elderly loved ones, you've been caring for them for 10 years, they've not gotten better. They are not so alive, they are not even dead, they are there with you and you are drained. What do you do? Let me start with Dr. Sakwe Emmanuel to react to this, and Dr. Kadia will react to this. I think this question covers a lot. This question covers a lot for people who have elderly loved ones. So, Dr. Emmanuel, please. You can unmute yourself, please.
Oh, I'm sorry. So thank you for the question the person who asked, and then Dr. Kadia, thank you for the very, very insightful presentation as well. So what did you do when you're drained? You are seeing your elderly loved one just going down the drain, and then you can't do anything about it. So I'm kind of passionate, and I just want to piggyback to this concept of, you know, who shares who does this burden of cost lie on? Because I've had my dad at some point say the same thing Jude said, oh, I don't want to be spending money. We already know where this is going. I want my children to just enjoy their money. I don't want to be spending money. But I think that's where we need to let these people who have stood there for us when we were much younger, let them know that it's not a burden. We're just trying to do our part. That's one. The second arm, which I'm trying to still emphasize, will be that at some point, let's be real. Care of the elderly is capital intensive. It's costly. There's only so much subsidy that even Stocknest will give you, because you have to also maintain your own operational costs. So down the line, as we kind of envision this thing, you know, ballooning into something that is much bigger than ourselves, would be how to get it under the NHIS cover, at least for those who can, you know, be part of the NHIS. Let the NHIS have incentive or remuneration or cover some of the costs of home health care in Nigeria. That will be the way to let these people know that, you know, you're not bothering your children, or you're not bothering us only. A huge part of the cost is coming from the government as well. So until we get there, we just need to keep educating and conscientizing people that if people stood for you when you were younger, it only makes sense that when they grow older, you cannot care for them, especially in those cases where your parents stood for you. I don't know if Sadia wanted to add something to that.
Okay, thank you for your contribution. Actually, that's a question that has always been on my mind too, because I used to tell people, I said, okay, like in my family, I used to say the females have longevity. Like my mom's mom died at the age of 86, and my dad's mom died at the age of 104. My dad's mom never had much problems, but dementia set in. And with your kids, definitely it gets too burdensome and stuff. And right from when I was a kid, that's when I kept saying, okay, we needed an old people's home. And I kept telling my moms, we need to take you to an old people's home. And they'll tell me it doesn't run in our lineage. And I've had friends again that, okay, they still have elderly ones. Okay, like my friend's dad has a stroke. At some point, she gets so drained that she'll be like, wouldn't dad have been better than this stroke? This is just 1 year. The person asking that question said 10 years. The person giving the care equally needs a psychological counseling. You need a psychologist to actually counsel you. Because just like you rightly said, Dr. Sakwi, those people took care of us. So we need to take care of them. Like when you were a kid, there were so many things that parents expected us to do and we never did them at the right time and when they expected us to do. But they were patient with us. Likewise with our elderly ones. Like I said, in Nigeria, people have not come to terms with the old people's home. But that is where it comes in. Okay, you have people, especially for the ones that have the money. But like you rightly said, NHIS, if it can come in, it will go a long way to do that. Because most people pay out of pocket for their parents to be taken care of in such homes. So if NHIS can come in, at least even the money you're contributing, like what I used to tell people, I said, hardly do I fall sick, hardly do I go to the hospital, but the NHIS removes my money. It comes in and goes out every month. If they can now use it to take care of me in my old age, I'll be so happy that at the end of the day, okay, yes, at least it's money I contributed towards my own care. So that would be one thing that would be very good if NHIS can look into it about the care of the elderly, at least even the ones that work for the government at retirement. Like NHIS is not all about the government because privately you can actually queue into NHIS and then keep your money and it's coming. So that would be a very long way to go. And for the caregivers at home, like I said, psychological counseling goes a long way because no matter how good we may sound, it's not easy taking care of an ill parent because it stops you from going about your regular activities. It's like Nigeria, like I said, is actually gradually going up to what is out there in the Western world. Caregivers are hardly willing to do what they want to do. Like if you have a CCTV camera, you may not even like what they do to your own parents. They slap them, they do things. It's unlike abroad, sir, where at least the people know that they have to be cautious to those people. But Nigeria, everything works. And then people will be like, okay, no, I don't want to do this. I don't want to do that. But yes, psychological counseling for both the parents and the caregivers, I think is one of the things that is of essence. Thank you.
Thank you. Thank you very much, Dr. Kadia. I think what I'm picking from here is that even in the health insurance thing, SNOGNEST would have to be in somehow so that people can do a health insurance for their elderly loved ones to have SNOGNEST take care of them. This question, I have an image here, something I remember that covers this question. What do you do when for so long you've been caring for your elderly loved one and they're not getting better and you are drained? Drained was the last word in this question, and you're drained. Housemanship, surgery posting. We had a patient with multiple myeloma, a woman. This woman practically had her bones crushing, melting, breaking. If you touch her, you want to lift her up, a bone will crack. You want to turn her to the other side so she doesn't have bed sore, bones will crack. So she practically was like a vegetable. So she was on life support. They had an NG tube for her, feeding her through the NG tube, giving her oxygen every now and then. And then I finished my 3 months of surgery posting. She was practically just lying down there, her head on one side, Her eyes are were the only things that would follow you if you're walking past, because she wouldn't turn the neck. I'm sure the bones were all crushed in the neck. Everything, she was like a melted human being lying on the bed, flat. She was almost flat, like, bread that is unleavened, because the bones were all crushed. But I finished surgery posting and she was not dead. She was there, and her daughter, a lot of people were coming initially, and then only her daughter kept coming to check on her, bringing the food they would make and put through the NG tube, clean her up. I went to another posting. I was finishing housemanship, and she was there enthusiastically initially, but towards the end, I would see her and she would just wish that Mama would just go. Let Mama just go. Her money was finished. Every energy was sapped. The thoughts, the image of seeing her mother like that was killing. Everything was gone. So one day I was just passing. I saw the ambulance backing towards the female surgical ward, and I came close and I saw her crying, the daughter crying. Mama had finally gone, but she was crying like Mama shouldn't go again, because the love is there. That embodies this question. What do you do? The person has refused to recover and has not died, and you love this person so much, and all you have is finished. You're drained emotionally, financially. What do you do? Okay, so how does all my Snugmails crew are present here? What will you do for people like this? Now we have to look at our structures. Now we have to see how we can help people like this. First of all, the cost has to come in, because we have to get help from other sources so that those who have more can pay more. Those who have less will be allowed the same care with them paying less, And how do you need to even be able to prevent things from getting to this point so that somebody can help you, the right care at the right time in the right place, so that you prevent these pocket draining circumstances. Dr. Kadia gave us the whole diabetic foot ulcer. If your elderly loved one has a bad diabetic foot ulcer, you will not like it. You won't. Because you hear they're going to theater today, next week you hear they're going back to theater. At a point, you'll be like, for how long will this continue? Then the next thing you hear, there will be amputation, and maybe there's amputation, and the healing you're expecting to see from the amputation does not happen. You hear we have to amputate higher again. You hear you now need prosthetic limb. None of this thing is palatable. So let us see if we can make life better for all of us. For those parents, they finish strong. Until everybody likes a situation where their loved one will live so old, and then on that last day and sleep into bliss. And you see the poster, celebration of life. Everybody would like that. So in the next 5 minutes, let's have our interactions and we close this webinar. I want to thank everybody that has been here. If you want to speak freely, you can unmute yourself and speak. If you have further questions, and then all those who have mailed in questions, we are going to share the questions with our guests and mail the response to our questions back to you, as time goes on. So,
thank you, Dr. Alex. I think there's someone in the chat who's got a question. I think someone's hand is up.
Someone is raising their hand up.
Yeah.
Please unmute yourself and speak, please. If you are here with your hand up, please unmute yourself and speak.
Okay, good evening, everybody. Can you hear me?
Hello. Yes, we can hear you loud and clear.
Okay, I'm happy to be in this Zoom meeting. My name is Dr. Mbasti Manyebuku. Dr. Alex has been my senior. Dr. Fatou is also my senior, and it has been a very credible adventure learning from both of you. Dr. Kade has also done a very effective job. I appreciate everyone here. And I just want to say maybe a few words of encouragement to some of our listeners here who have elderly people at home that they have cared for a long time and they are now drained. That is the last question that we are all attending. There's basic things that you need to understand, whether you are medically inclined or not. There are some conditions that are not curable, that can only be managed. Having this basic understanding of such conditions will help you in the long run. Things like what we have already discussed about type 2 diabetes, hypertension, Alzheimer's disease, dementia, late presentations of cancer. These situations are not curable. So you need to understand that from the word go. And then there's also something that we need to understand, which is very common and rampant now in Nigeria. We need to differentiate because all these things are interrelated. You see our culture, our faith, fiction, and reality. Okay, when you understand, it will help you very well. Because having worked in hospitals for some time now, you see people, mainly this issue of diabetes that we're talking about. The person is diabetic, he goes to church, the pastor or the man of God tells her or him not to take his medication, drink this water, you will be healed by the power of Jesus Christ. I'm not against your faith. Jesus is good, God is good. But the reality that is on ground is that anybody who is telling you that Jesus' name is going to heal your type 2 diabetes is just lying to you. So you need to know this. Anytime you have this type of condition, it's better you seek the help of an expert. And this is where the snugness comes in to give you basic education, counseling, okay? And then coupled with other non-medicinal modes of treatment, the condition can be managed. And then you can live longer, as Dr. Kadia said, you can live longer and healthier, okay? So thank you very much for this show. It has been very wonderful and I learned a lot. Thank you very much.
Thank you. Thank you very much, Dr. Umba Stephen. It's been decades since I saw and heard from you last. I'm delighted to hear your voice today. God bless you. Rufus Vashawa, I see your hand up. Please unmute yourself and speak, sir.
Good afternoon, everybody. Thank you so much for this wonderful organization and also our two presenters that presented. Two things I want us to, what I learned here today is that we need to work on two aspects of our lives so that we can have this program a success. That is our cultural belief, then a working national health insurance scheme. When we work on our cultural belief, and also we have a standing of working national health insurance scheme, I think we'll be able to help our elderly people. That is my one little contribution, and thank you very much. Good afternoon.
Thank you very much, Mr. Vashawa. Our cultural beliefs. So thank you very much, everyone. You see where we now come in with the education on our culture and with advocacy for a better policy for the elderly and health insurance for the elderly. And then picking from what our both speakers have said. So imagine that your elderly loved one has a chronic illness they are dealing with. Dr. Umba Steve has mentioned that there are things that are not curable. You have to manage them. Now, for them to be visiting their physician every once in a while, and you have Snugness taking care of them, Snugness will be giving those reports that are necessary so that their physicians are not living with you and with them. You know, with Snugness reports, it helps their physicians to give them the best of management. So Snugness will stay their day-to-day blood pressure, how their feet are doing if they're diabetic, how their back pain is doing, how they are responding to the medication that their physician has given them. Snugness will give a report by the next visit they are going for their physician to check on them. Snugness will give them a report they will carry. Their physician will perfectly understand what has happened in the interval between the last time they saw. This is a perfect way to handle everybody who is sick, and especially our elderly loved ones who sometimes cannot help themselves with certain things, you know. So in the next 2 minutes, so your final word, Dr. Osakwe, and your final word, Dr. Kadia, so that we round off, please. Dr. Osakwe, you first.
And the final word, thank you for this initiative. There's a lot of people who benefit from this. Just one interesting statistic again, while we're at it, over 400,000 Nigerians are currently in the United States. Most of them have their loved ones back home. Personal example, I had my dad who was ill. I was going back and forth and he needed home health. So most people can make their lives a lot better when they have services like this, home health, available to them. So let's keep the good work going and let's see how we could integrate it into the National Health Insurance Scheme long term. And that would help us a whole lot. Thank you.
Thank you very much. Dr. Kadia, your final words.
Okay, thank you for giving us this great opportunity to talk to this great audience. Like Dr. Osakwe has said it all, at least knowing that we have Snugness there to take care of our elderly ones is one of the greatest achievements here. So everybody that is here should just spread the words around. Snugness is here to take care of your elderly ones, be it at home or if you want them to be in an elderly people's home. I know with Dr. Alex spearheading that Snugness, I know your patients are in safe hands. I won't call them patients because they're elderly ones. Your loved ones are in safe hands. So, and we too, we should do well by taking care of ourselves. So thank you.
Thank you very much, Dr. Kadia. Thank you. We started with an outreach in Kwale Area Council, and then we gave 50 elderly people in Kwale Area Council health insurance with Kwale General Hospital, so that when they go for their treatment in Kwale General Hospital, we pay for their treatments, their consultation, their tests, their drugs, we pay. Unfortunately, we lost one of those clients to kidney issues. About a month ago, we got the reports that she passed and she has been buried. And yeah, but this is how we started with Snugness. So I want to thank the crew. Our executive director is here, Ye Blessing. Thank you so much for your initiative. You know, when I was in school, I was in the Legion of Mary, and we used to go for Legion walk. And there's this old people's home that is owned by the church in Enugu. I used to visit old people's home there. Sometimes I used to be in the kitchen, helping them with cutting vegetables, washing their clothes, or even chatting with the old people. So when Blessing called me and talked about this idea, I did not spend a second to respond like, let's do this. And here we are with Snugness moving. So I want to thank you, Blessing. I want to thank all the crew of Snugness, our admin, Stephanie, Dr. Paul Agada, Mr. Emmanuel Agada, Dr. Jennifer, I see you, Ebere Nadozie, I see you. Dr. Adonis Chris, our man in Kwale, thank you for all you are doing for us there. I see you. Jennifer Nadozie, Doctor, I see you. All of you, our admin, Stephanie and Dene, thank you people for what you've been doing so far. Dr. Oke, Mwazu, all of you wonderful people. Abdullahi Mwazu, Omeza, wonderful guy. So, and all our guests who have graced this, we'll be doing more of this, and to announce to you that something is coming up in November, something bigger, not a webinar. Maybe a webinar will precede it, but it's something bigger. You'll be shocked at what you're going to hear. I'm not going to say what exactly it is, but you start seeing our posts and our adverts for that big thing that's happening in November very soon. It's going to happen on World Diabetes Day on the 14th of November. And in fact, the weeks preceding it, we are announcing our presence like that big way. And then please use our emails. You see our flyers all over the internet. And I want to thank our media crew. You know, they are doing a wonderful job. And our social media managers, they're doing a wonderful job. They are here. Thank you for the job you are doing. You're going to see a lot of posts from our social media managers, our adverts and everything. Contact us through the phone numbers you see, contact us through the email addresses you see, go to our website, see what we're doing, follow us on our Facebook page, all our pages, follow us, please. Follow us. Just they do follow, make me they go. Thank you so much. Again, my name is Alex Nadozie, and we are signing out. Have a wonderful rest of your day.
Thank you.
Thank you very much.